Hello. The nasal cavity and the nasopharynx and the common diseases associated with it. Okay? So as you can see, this is a simplified diagram of the nasal cavity, which is shown in blue, this part here. So this is the nasal cavity, which starts from the nasal aperture and goes all the way down to the nasal corona. And the green is the nasopharynx. So, which is this part. Hello?
कैमरा ऑन करें सर आपको
हेलो
स्टूडेंट की आवाज आ रही है आप चैट पे लिख दें कि अगर आपकी आवाज नहीं जा रही है तो रिप्लाई करनी है इसको
हेलो जी, can you guys hear me? Okay. So if you have any questions, just share it on the chat. And so basically, the nose is made up of different bones. Okay? They're unpaid bones, they're paid bones. And the unpaid bones are the ethmoid, sphenoid, frontal, the vomer, which is in the middle, and the paid bones are the nasal bones, the maxillary bones, the palatine bones, and the lacrimal bones. Basically, the ones on the side. The ones in the middle, they are single. So the function of the nose is the sense of smell and also regulation of temperature and humidity. The purpose of the nose and the nasopharynx is to act as a conduit for taking air from our nose and putting it, sending it to our lungs and sort of filter it slightly and humidify it. So paranasal sinuses are spaces within the facial skeleton, which are normally filled with air, and they are the source of lots of the diseases that we get. I'm pretty sure everybody has had sinusitis or upper respiratory tract infection in their lives. So there are 4 sinuses: ethmoids, sphenoids, frontal, and maxillary. See, they're written here. They make the skull lighter and add resonance to the voice. So the frontal sinus is in the frontal bone. It opens via frontonasal duct into the nasal cavity. This is the maxillary sinus, which opens via the maxillary infundibulum into the middle meatus. All of them basically open here. The anterior ethmoids, these are the anterior ethmoids. The frontals and the maxillary open in the middle meatus. Sphenoids open in the superior meatal recess. So the common diseases in the nose is rhinitis, right? Which is the inflammation of the nose, causing swellings of the mucous membranes, which is characterized by a runny nose and stuffiness, caused by a common cold or a seasonal allergy. Right? I'm pretty sure everybody has had that. And the thing is, then you have to see whether it's acute or chronic. If it's chronic, if it's so rhinitis is classified as acute or chronic. Acute rhinitis occurs from a viral infection, such as allergies, bacteria, or other causes, and also COVID, right? So it's very common these days. Chronic rhinitis usually occurs with chronic sinusitis. That is, that it needs to be longer than 12 weeks, right? That's the cutoff criteria. Also, there's a classification as allergic or non-allergic. That is, if it's due to an exposure, due to a certain pollen or dust or anything, then it's called allergic. Otherwise, it's called non-allergic or vasomotor rhinitis. So allergic rhinitis is caused by a reaction of the body's immune system to an environmental trigger. The most common: dust, molds, pollen, grass, bees. So what we tend to say is, like, cover it in bed sheets. Cover your bed sheets with plastic, so whenever that your allergen exposure goes down. Symptoms of allergic rhinitis: the most important is itching, because which is not limited to the nose, which is also involving the eye or the skin. So there are three grades of severity. If it's limited to the nose and eye, and limited to the skin. And also sneezing, and the sneezing is very different. There are about 6 to 7 sneezes in one go. A runny nose, stuffiness, itchy and watery eyes, headaches, swollen eyes, a cough and a wheeze. Because a lot of allergies, they tend to end up with asthma. So if you are going to not control the allergies in the beginning, after 20, 30 years, you could end up with having asthma and later on pulmonary fibrosis. The treatment of allergic rhinitis is simple. Avoid the substance, nasal steroids, antihistamines, nasal irrigation, antibiotics are not required. And the correct way of using the steroids is put your head down and then use them, not put your head back. Otherwise, then you're just watering your throat. So now we're talking about viral rhinitis, which is kind of the thing of acute viral rhinitis can be caused by a variety of viruses. Usually it's influenza, but sometimes they're like coronaviruses and a lot of others that can go. And they appear with a cough, sneeze, post-nasal drip, low-grade fever. But in terms of COVID, it has come down to anosmia, high-grade fever, and a mild fever. It's like 100 to 101, and anosmia is there, and with the cough. The cough is very different when it comes to COVID. It's a sudden, severe bout of cough, which goes on. This treatment is more or less symptomatic. That's what we've realized. Before, we used to say we should not be giving steroids when it comes to viral rhinitis. Now we are giving viral deltacortal and other steroids for viral rhinitis. And chronic rhinitis. Now this is the part where keeps us busy as ENT surgeons. Chronic rhinitis is usually an extension of rhinitis caused by inflammation or a viral infection. Clinical features include nasal obstruction, crusting, fretor, frequent bleeding, thick, foul smelling, pus-filled discharge from the nose. So decongestions may release the symptoms. Treatment of the underlying cause, as in if there's an anatomical abnormality, then you have to fix the nasal septum. Decongestions, you should use it with extreme caution, not more than 2 days. Atrophic rhinitis. Basically, this is like when you overtreat the nose with nasal steroids and all forms of treatments that you take. So the nasal mucosa just falls flat, and you will examine a patient and he will have nice nasal passages but complaining of nasal obstruction, but a very, very bad smell. It happens in older people, can be due to systemic diseases, diabetes, can be due to overtreatment by steroids. So as we discussed, that it has a very, very offensive odor, and people also lose their sense of smell. Treatment is aimed as reducing the crusting. You reduce the crusting by taking 25% of glucose mixed in glycerin, and you paint or drop it into your nasal cavity, so that what it does is that 25% glucose is quite it sucks out all the water. It's very hypertonic solution. So what that tends to do is limit the bacteria from growing, eliminating the odor, and that again is by nasal irrigation, and reducing the infections by antibiotics. So vasomotor rhinitis is a form of rhinitis which is caused by nasal stuffiness, runny nose, and it's basically disbalance of your sympathetic and your parasympathetic systems. So basically, your parasympathetic system overfiring, then you need then you get rhinorrhea. See, when your sympathetic system is firing, then what it tends to do is open up your airway. When your parasympathetics is overfiring, then it causes rhinorrhea or rhinitis, and you have various agents to curb this, such as sodium chromoglycolate, which can be used. First of all, you should always talk to the patient, teach them about steam inhalation, that you should not be using Vicks in your steam because it tends in your sinuses. And instillation of nasal drugs is very important because, like, if you put your head back, like I said, it goes down in your throat. But if you put your head down and then the nose, then it is in your sinuses. Hand hygiene, we can't stress enough about it. Sanitizers have become the common state these days. So bacterial infections can occur in the nose, like we have like hair in our nose, which is called Leprosy, and whenever there's an infection around it, it's called nasal vestibulitis caused by a staph or infection. It is quite painful, but simple ointments such as Polyfax, which contains bacteria tracing, is quite good. Very seldomly do you need systemic antibiotics, but it can go into the brain. And furuncles are like boils, which is like quite tender, but the thing is, it's invading the dermis. So when it's invading the dermis and it's not limited to the surface, the epidermis, then you need to go for the antibiotics. Now coming to the other point of my lecture, this is quite important. These are nasal. We're going to talk about nasal polyps, right? Does anybody know what a polyp is? Unmute yourself. Okay. So polyps are teardrop-shaped outgrowths that form around the openings of the sinus cavities. Hold on, I think I'm disconnected. Can you guys hear me? Hello? Yeah. So polyps are common teardrop-shaped growths that form around the openings of cavities. When you leave your allergies untreated, like people that normally come to me, they have had allergies for about 10 years. I say, like, we have had it, then you stop taking treatments for it. And then they slowly the allergies worsen, and they were just like living their life with it. They had just said, like, we don't want any more further treatments. So what it tends to do is allergies, they cause rhinitis, which cause water to pile up in the nasal mucosa. And when the water piles up and you continue breathing with your nose, what it tends to do is stretch the mucosa. When it keeps stretching, at a certain point, the elasticity of the nose goes away. When the elasticity of the nose goes away, the nasal mucosa goes away and it's down. At a certain point, it does not rebound back up. So then it starts forming a polyp. So, like, it's a very good description here. A mature polyp resembles a peeled seedless grape. That's what it looks like. Sneezing, nasal obstruction, postnasal dripping, facial pain, excessive discharge, loss of smell, reduced ability to smell, itching around the eyes, chronic sinus infections, right? So I changed the mnemonic, to remember all of these things in a very busy slide. What I tend to do is write congestion, rhinorrhea, itching, smell, sneezing, snoring, postnasal dripping, pain, epistaxis, and deformity. Treatment, steroids, surgery. Surgery should be done early, and it should be done in hospital because it tends to improve the outcomes. So, inflammation in the paranasal sinuses is another common thing which everybody else has suffered with, which is inflammation of the sinuses, most commonly caused by a viral or a bacterial infection or an allergy. It may be acute, which can be short-lived, that is greater than less 4 weeks, or chronic, which is long-standing. So 4 weeks, 30 days, acute sinusitis happens. It happens in people with a normally functioning immune system, and acute sinusitis is caused by a viral infection. Sinusitis more than 3 months is termed as chronic. Allergies, polyps, exposure to irritants, such as airborne pollution, especially in chemical industries, petrochemical industries, and tobacco smoke, are all factors. And there's a familial tendency in nasal polyps as well. So if it's greater than, subacute is like in between these 30 days. Or if it's recurrent, acute, that means that it is greater than 4 episodes of sinusitis per year. Acute sinusitis has and chronic, they have the same symptoms, more or less. Just the duration has changed. Yellow or green pus from the nose, pressure and pain in the face, congestion and blockage in the nose, tenderness when touched, swelling over the affected sinus, reduced ability to smell, bad breath, and a productive cough, worse at night. So the pain in sinusitis is a pressure-like pain. Now that's a very important thing. If it's like an electric pain or a migraine, you need to do a differential of your headaches whenever you are dealing with sinuses. But the patient could be having vasomotor rhinitis with a migraine. So site-specific infections are maxillary sinusitis, which is pain over the cheek or just below the eyes. Frontal sinusitis, which causes pain over the forehead region. Ethmoid sinusitis, pain behind or between the eyes, which is like splitting over the forehead. So this is slightly different because it's a splitting headache on the side is more pathognomic of ethmoid sinusitis. It goes lateral, unilateral pain is migraine. Ethmoid sinusitis is just caused like a vague pain in around the back or the vertex of the head. So the complications of sinusitis are bacterial infection to the adjacent tissue. So, can anybody tell me what is the adjacent tissue? You can unmute yourself. What is around the sinuses? Anybody? So around the sinuses are the eyes and the brain. So these are the two tissues that that are affected by sinusitis. Periorbital cellulitis, orbital cavernous sinus thrombosis, meningitis, subdural lymphedema is often caused by sinusitis as a complication. So it needs to be treated. People need to be informed that that like if you do not treat your sinusitis, you can end up losing your eye or having an intracranial infection. So how do we diagnose them? History, physical examination, X-rays, CT scans. X-rays are obsolete. I've just put it down for the sake of completion. And a CT scan paranasal sinuses and a sinus culture by nasal endoscope. So treatment of sinusitis is improving the drainage of the sinus during the infection. Steam inhalation helps. Hot, wet towels over the affected sinuses, hot beverages like chicken soup is quite good. Nasal irrigation via saline nasal spray is also helpful. For acute sinusitis, you need antibiotics such as amoxicillin or doxycycline. But again, like given that it is Pakistan, it is highly unlikely that it will cure it because of the resistance that we are facing. But from a general practice standpoint, yes, you can definitely go with amoxicillin, 1 gram BD twice a week. People with chronic sinusitis take the same antibiotics, but typically for 4 to 6 weeks. Surgery. When antibiotics fail or whenever there is an impending complication that you need to rule out. And also nasal obstruction that is present that needs to be addressed. So what we are doing is functional endoscopic sinus surgery, which is via a tool called an endoscope, which is a thin fiber optic tube. And basically, it allows us to have a 3D magnified vision of the sinuses, so we can address it. And when we say functional, we retain the normal drainage pathways and we just improve them. Otherwise, if we just change the drainage pathway, then the word functional is dropped and then becomes endoscopic sinus surgery. So it is done through the nostril, leaves no scar. Swelling may occur, but it will disappear. Patient who has had the surgery will only feel mild discomfort for a short period of time post-operatively. Can be performed frequently, can be carried out on an outpatient basis. The latest things that are there are image-guided surgeries when they are, well, image guidance is used for trainees. It's a very good training because of the proximity of the eyes and the brain. For aspiring ENT surgeons, we use image guided to train them in endoscopic sinus surgery. This is an old method of doing it, a Cordwellux, where we go through the canine fossa to address the maxillary sinus. So this is very important. Surgery is only one part. Then we need to deal with the patient post-operatively. Like they can have respiratory distress because of like the dripping of the nasal secretion in the back of the throat post-operatively, swelling around the eyes. You know, female patients and male patients sometimes also tend to be worried about that. But just like telling them like it'll settle down in 2 weeks is sufficient. Allowing them to use core compressors also happens semi-high Fowler's position, that is like lying supine at 30 degrees. And sneeze with your mouth open. That's very important after any sinus surgery. Now, so we have covered viruses and bacteria causing infections. We haven't covered funguses. Fungi are can be due to Aspergillus candida infections, but Aspergillus, Mucor, they're the more dangerous ones. And once they colonize your sinuses, what they tend to do is they cause an IgE-mediated reaction. With the IgE-mediated reaction, which results in increasing sinusitis, then you just need to do a surgical, how would you put it, lavage of the sinuses to drain out, to take the fungus out, which is causing the IgE-mediated rhinitis. And if it is causing invasion, then it becomes a problem. Then you need to give like antifungals for about a good 6 weeks. If the patient still develops invasion into the eyes and the brain, then they might need antifungal therapy for the rest of their lives. See, we talked about the allergic fungal sinusitis, which is a chronic sinusitis caused by a fungi causing an allergic reaction. Surgery is not required. Is required to open up the sinuses, remove the fungal debris. Long-term treatment is with steroids and fungal drugs. But again, corticosteroids can cause the fungi to colonize again. So you have to find the balance. So same symptoms with greater than 90 days is chronic rhinosinusitis. So the mainstay of treatment in both is nasal steroids. So we have an important situation when we talk about sinusitis. It's the Samtis triad, which is aspirin intolerance, decreased mucociliary clearance, and sinusitis. So sometimes we can have a benign blockage of the goblet cells, which produce the mucin, which causes a mucocele, and excision is via endoscopic approach is the gold standard for such things. Bacterial infections such as scleroma is a chronic Rhinitis disease of the nasal cavity and nasopharynx caused by the paranasal sinus bacterial rhinoscleromatis. Leprosy is rare, but again, bony destruction is common, but the cartilage remains intact. Normally, whenever we do a surgery, we get a saddle nose by the disruption of the cartilage, like in case of over-resection of the nasal septum. So, maintaining a patent airway. Now, this is very important for sinusitis. Is like positioned by lying down on alternate sides every 2 to 4 hours to prevent secretions accumulating in the airways on one side. Maintain the neck in a neutral position. Just percussion and postural drainage may be prescribed to assist the removal of tenacious secretions. These are very important, and they ease. The more secretions there are, the more harder it is to get rid of it. I recently had an infection. I used this position on alternate sides throughout the night so I could come back to work in the morning. Always accept the patient's description of pain. Everybody has a slight variation when it comes to pain, right? So always that. Like before jumping to antibiotics or a pain medication, always give relaxation and breathing exercise as a non-pharmaceutical way of relief. When we say go and rest, we mean just like relax and breathe well as well. Frequent hand washing prevents upper respiratory tract infections. Complete the antibiotic treatment regimen because we don't want to end up without antibiotics. And wear a mask. So these are the common acute inflammatory diseases of the nose and the nasal, paranasal sinuses. Understanding the proper, with the proper knowledge of these diseases is quite important. So we are at the end of our lecture.
अस्सलाम वालेकुम सर।
हेलो,
अस्सलाम वालेकुम सर।
जी वालेकुम सलाम।
सर लेक्चर एंड हो गया क्या आपका?
जी
लेक्चर एंड हो गया आपका?
जी लेक्चर एंड हो गया। एनी क्वेश्चंस? Any questions?